Hi, how are you?
Hi, I'm good. How are you?
I'm fine also.
I'm London. May I have the patient's name?
What? The patient with me here is Abdullah Usman. He is a 4-year-old preschool child
Who is
born
the,
to a parent that earn less than $100 per month.
the parent makes $100 a month?
Yes, less than that.
Less than $100 a month. Okay.
Yeah. Who presented to the hospital with history of passage of bloody stool, yes, abdominal pain, and then there is associated history of weakness of the body,
Weakness.
loss of appetite, and a history before presentation of fever.
Is the fever like constant or is it intermittent?
The fever is said to be intermittent.
What is the life like at home?
The life, yeah, the environment there is a low resource community, a poor sewage disposal system, and there is history. They live in an environment that is overcrowded.
So, can we take the temperature of the 4-year-old?
Yes, the temperature is 36.8 at presentation.
I say we should run a test for malaria.
Yes, the test was done, and it has the microscopy showed that it's two pluses,
Two
while
plus. Okay.
RDT showed that it is
Positive.
positive,
It is
reactive. Yeah.
positive. Okay. And I also say we run a blood culture so that we can see if the patient has anemia.
Then, from blood culture, what other investigation would you like to do to this patient? Which other investigation would you like to do on this patient?
I want to see if the patient has anemia because that'll be severe anemia is a complicated symptom of
Yes,
malaria.
yes, we did the PCV is 23%.
Since the patient is positive for malaria,
Yes,
we need to do a ACT,
yes,
which is combination therapy.
at the missing combination therapy.
Yes.
Nice, but there is history of passage of blood stool.
The patient is having bloody stool and abdominal pain. So then they're having
Yes,
a a complicated version
a
of
complication of malaria.
yes.
Yes, yes.
So you want to give it artesunate, an
In
IV of
each,
artesunate.
yes, IV of it.
Is there any
Yeah,
chest pain, any headache?
there is no
Um,
headache. There is no chest pain.
is there any swelling of the liver or the spleen?
There isn't, but there is abdominal distension. For that reason, we cannot ascertain whether there is liver enlargement or spleen enlargement. And the PCV, what will you do to the patient?
We should get the patient. Does the patient eat? What is the patient's diet like? What does the patient eat?
Yes, normally eat the domestic diet, which is usually more of carbohydrate than protein.
So the patient
Yes,
definitely needs to get more iron in, and that
yes,
can come from like vegetables, different vegetables, milk. You
yeah,
can vitamin
yeah,
B12 and folate.
yes. That is very good. But I'm very impressed with that statement.
Thank you.
Yeah, it's better you look for nutritional rehabilitation,
Thank
isn't
you.
it?
Yes,
So
nutritional.
yes, what will you ask the patient to do when they go back home?
The patient needs to definitely change the diet. They need to change the diet and they need to make sure that they're getting all the nutritional supplement that they need. Well, we can give it vitamin B12 and folate to also help with the anemia. I would like to see what the child's hemoglobin count is, and if it's below 7, then we're going to give the patient a blood transfusion.
I'm very impressed with your performance.
Thank you.
You have done well, very well.
Thank you.
Thank
Please
you.
tell the patient thank you for letting me
I,
diagnose diagnose him.
yes, she's waving at you.
Yes, I see her.